Guys, you can ask me questions if you want. And I know some of the movement you weren't able to see, so you can ask me. Welcome. You can make some if you want. And if you would like to know what she's feeling, you can ask her. The kind she's participating in the live. So basically, I'm on her toe and I'm using the flex point therapy, which is reflexology. And she's actually feeling a little pain now when I touch the area, but it won't be for long once it go away. And when you're stressed a lot, when you're going through a lot of stress, what will happen is that you will feel something. Oh, the audio is going in and out. How are you feeling? Hot from 1 to 10. Still hearing? Still not hearing me? She says it's painful, but I'm just giving her like baby touch. I'm not going deep, not like a deep tissue, more like a Swedish massage touch, very lightly. That's what I'm doing. But she's saying that it hurts because her body is in a lot of tension. Can you hear me still? And most times when we feel pain, remember we're actually feeling the pain already before the body starts to put off a reaction, because the body fights itself, so it repairs itself, but after it's getting too unbearable, very low, it's what? Sometimes, okay. I guess that has to do with the internet. That has to do with the internet. I can't do anything about it. But you can just watch the movement that I'm doing or ask me questions. At least I'll be able to see the questions. And I have somebody can type what I say, just in case if you have questions. So I noticed the client that I'm doing complain of stress, migraine headaches, and problem sleeping. So I'm working on that area to let them more be relaxed. Sometimes zone out of focus, and this therapy will help them to just, heal the mental state of mind. Take deep breaths in and out. This was not a planned live, just feel like come on here. And, yeah. to hold the foot, with not to hurt my hand during the service and also to protect the client. That's why I hold the foot a certain way. So you might not be able to see everything. Wow. You feel that? She's gonna feel great when she's finished. Her toe feel like a bucket of ice. I'm just doing baby touch. It just feel like a lot of pain, but as you can see, just baby touch. Even though it's painful, it's just baby touch. It's just that I'm going where you have the blockage. What happened? So at no point in time you don't feel good, you're only feeling pain. You don't feel good any at all? No, not a stop? You don't feel any way? How you feel now? Yeah, that's supposed to. You can see this on here? No wonder you forget things. No.
Oh no, I clearly must scream out now. Honestly.
Don't shake your foot. You'll hurt my hand. You hear that?
I hear it, but when I feel it because someone in pain, but when I feel it like someone like
Wouldn't it be nice if you have somebody rubbing down your foot like this? Just lie down and have somebody rubbing down your foot all night.
what is that? TikTok? Should I send these emojis? I don't understand.
Okay, so right here, so watch the color changes in your foot right here, because right here can tell you how your liver is, right? But while we don't diagnose anyone, it still can show your liver health by the discoloration. So I've noticed over the years of practicing, once the person would come and it was okay before, so I take pictures and go through, and that's the tips that I'm leaving with you today. Um, Once they start getting black right across here, like really black. If it wasn't black before, because some persons are genetic, meaning that if you're from the maroon line or something like that, or just genetic, and you may be dark skin, so your skin may be discolored here, but you can still know the difference for the liver health. So gut health, the kidneys just across from here, the adrenal gland, the thyroid. Um, so basically, you can watch here to determine how your liver is. Just leaving a little tips with you, and then your adrenal gland. And for men who because that female go through postpartum depression, um, sometimes when they after pregnancy. So basically, sometimes after pregnancy, like maybe 6 months or a year, it's good to get a reflexology massage to just help with the mental state of mind, and especially if you didn't have fibroids before, so you can feel that right down here near to um, the gut area, and for a person struggling with back pain, the heel, which is where the sciatic nerve is, and right along here. And then we have the large intestine and the small intestine. So you will find some changes in bathroom, going to the bathroom a little, going to the bathroom a little bit more frequent. It's okay now. Going to the bathroom a little bit more frequent after reflexology, or passing your stool a little better, sleeping better. But you must have a focus point when you're doing the service, because there's so much things can be happening to the human body. That's why we don't recommend one service, because you must have a focus point. Now I'm working on her spinal area right now. She's feeling a lot of pain, and all I'm doing is just baby touch like this, just baby touch, and I'm on the spine, just massaging it.
See that extremely hot.
It's so stuff.
You'll feel discomfort at first when you're doing it, but after a couple seconds, you will feel that you feel the pain go away, or the discomfort go away. Just to show you that you need exercise.
This is hot. I'm still hot.
And the pain was
Actually there, and the discomfort was actually there before I start touching it. The fact that I touch it and you feel that way, that means a healing is going to take place, because there is nothing there for me to break. See, that's all I did. And you can see how far my finger sinking. You see how far my finger sinking? But you just have to know the right place to touch, right? The right flex point to touch. And it comes with experience. And you're gonna feel better when I'm finished. Even your head's supposed to feel light and feel good.
yes.
Yeah, blood is flowing, and as I said, she will just have a better mental health. Even her foot, so the blood starts flowing through the foot, so some circulation problem is going on there too, because she's having better circulation, can see the blood in the foot. I'm definitely going to come back live with a better view. headaches, it helps you with gut health, and it just clear up. So we get medication, right? So we have a head that hurt with, and we say, okay, we're gonna take a painkiller for the headache. But the pill is actually absorbing all over the body. So while it's healing somewhere else, it's going somewhere else that don't need it. But it leave a reaction there. So reflexology is what heal you without damaging you. But you still have to go to your medical doctor and make sure that you're okay. I believe that healing takes place in the full completely. So
See, this hot.
okay, Pastor. You notice from another day you're walking and going forward, just look at her how she walking or she stand up, she bend forward. So our posture is really bad. And all I'm doing is that, I'm not doing anything to you. I just rest my hand there. That hard. See?
Especially this one.
And all I'm
You know, it's just using my tongue to just glide across and it hurts. So that means the physical therapy here.
need to exercise.
Don't need to laugh. As you can see, she take away my hand. Okay, how often do you do a service like this? How often do you do a service like this? You can do this every 2 weeks. And if you just want to live a healthy lifestyle, avoid the doctor, the middleman, just do it actually every month. Alright? And you won't have no problem.
It do everything.
You want it detox, you relax your muscle. If you're out there trying to get pregnant, wondering why you try everything and the doctor saying nothing is wrong with you, you can try this method. And my client here wants to get pregnant, so I'm sure when I'm finished, you will get pregnant. Yes, and I need to do the next pose. I have to balance you. Come, put up your foot.
You're not feeling it.
Pain. It's not pain. So what is this?
You need to let me finish.
It will go away just like your toe. Remember how hot it is? Watch here now. Now I'm squeezing your toe. See, it's gone. Headache's gone. All that headache that you were feeling. Yeah, it's gone. You need to let me take out the pain out here too. She could hardly bear it. So let me take out the pain from here.
It's not even hot.
Yes, but what you're going to do is take deep breath in and out with me. And you'll be fine. You don't want the next one to be done?
Who can benefit from this?
Person with the blood circulation problem, not going to the bathroom regular or going too regular. Basically everybody, persons especially with arthritis, haven't you tired to hear your family speak about, especially the elders in your family speak about arthritis pain? It's excellent for it. And persons who can't sleep, or you just easy to get angry and can't deal with stress, excellent. Ready?
And if you have long
Long-term pain from, I've seen persons come to me and have pain from teenager and they're big people and after 2 service, even after first service, they don't feel any more pain. Yes, you have back pain? See? She said she feel a lot of back pain and I did not know that. I just know that she haven't been walking properly from other day. She's been leaning forward.
And most time we
have kidney infection, doesn't mean that something is wrong with their kidney. Just have a little infection. Some people don't know, but they drink water and find out that they're peeing than usual, and after a while it stops. Sometimes kidney stone and it go away. This also help you. You can't stiff up while the service. Just relax. It can go away. There's a lot of build up right here in the spinal area.
and I'm sure the viewers
Viewers would like to know if it will go away. And I also know when they're feeling the pain. Don't ask me that how I know, but I know. I know exactly where to touch. Yeah, but I'm not doing anything. I'm actually taking away the pain. It's okay. Take deep breath.
Remember, when I went through the difficult, so
Turn on the AC. And all I'm doing, if to know how her back is in flames, you can see, like I'm gonna bring the phone a little closer. You can see right here on her foot. I don't know if you guys can see. Let me just show you on her foot right here. Look right off here. Look if you can see that I'm showing. You see that? You can see the blood flowing. Yes, that's it. Can you see? Just look right here. And all I'm doing is showing. Oh, it stopped. I want to show you guys what I'm actually doing. Is that showing? Showing the foot now? Right here? That is all I'm doing. That's it. Trying to fix so you guys can see. Have to hold it, it's going to shake. That's all I'm doing. That's all I'm doing. And if you can know that something is going on here because look on the color. Look on the color of her foot, you know that something is going on here, and you can start seeing the blood flowing right here. Look at that. She didn't have that when we just started, it wasn't showing. So a lot of blockage is right here. So we're trying to free up that so she can feel freer. And the toe area, I couldn't touch here any at all. Now I'm able to touch it without she feeling any pain. And the neck area here is still right here, so supposed to still feel a little tender. You feel a little tender right inside here? Right, so all I'm gonna do now is just glide my hand like that and see how she feeling. Is it okay? Right, so I'm gonna go back and start, and all I'm going to do is just some rotation with my tongue. I'm not gonna do the walking, just some rotation. She's supposed to feel feel some burning and some stinging pain because it's actually working now. It's actually clearing up. I couldn't go so deep with my finger at first. It's like it's stuck on something. So now you know that it's clearing now. And I want to get her to just relax while she's doing it. Talk to me. Talk to me. Tell me how you're feeling. I guess she's using her waistline to do something that she's not supposed to do. Maybe she's lifting up some weight, taking up something that is heavy, or she's sitting too long, or she's carrying something on her waist that she can't manage. And that was for you guys to laugh. But alright, so I need you to just stay. It's showing me or it's going on the wall? Okay, because it can. And I know all the movement you will not be able to see. So I'm just doing a little stretching and go to the next foot. The cameraman have no experience, but she's trying to help, and we appreciate her. So don't be mad at us, guys. Put up your foot, Julia. And when foot beauty did I give you, I may alone get all of it. No, it's not. You have strong feet. You don't must. Can go through worse. Can be less. Are we seeing? Yes, so a drop pressure is in our head, neck, and spine. That's where all of your attention is. Worry too much radiation from the phone at night, also having the phone at your head. That's why it's good to get married and have your spouse beside you, because the long phone call, that can affect you. But I don't know why she has so much pain in her head, but so much headaches. We have to try not to worry and stress ourselves. So I'm returning back the procedure to the next foot. But when you're doing the foot, right? What would happen? Not because that foot have the same problem doesn't mean that this one have the same problem. Okay? And most times on the right side, you can be going through something on the right side, whether you get an injury or something, and is the left foot feel it the most because I guess the pressure. And you know the funniest thing, the small toes from small toe, all the toes then connect to your senses, meaning that you're feeling, you're tasting, or you receive information and give information, or you eat. reflexology because she's not allowing me to use my flex point to do anything. She can't bear it. It's so tender. But she's going through so much. For the person to even underneath her toe here, so it is so blocked. And the next one is not like that, so so blood flow underneath here. She needs more blood flow, more oxygen. A lot of clear up need to go on. Alright, look on that foot, how it block on the foot top. So we need to do that so they can clear up. We need to finish. Look on her arteries, how they rise, blood more flowing. We need to stretch out your feet so we can finish. Check your blood count. Because her foot was so pale. I said, I'll look at that and look at what it is. Is it? They can't say what it is on this one.
To go harder.
Something harmful, you would continue to feel pain. No more pain, right? See, just need to bear it. She not feeling no more pain, right? I'm not difficult to attention, but not as hard for you to cry.
At least it goes right and you're gonna feel better. You feel.
They say